is that hospitals are reimbursed at pennies on the dollar for treating these patients, receiving less in payment than the actual cost of care. And in most Virginia hospitals, the majority of inpatients are Medicare, Medicaid, and uninsured. Due to government mandates, that means hospitals are providing substantial free and discounted care, which can and does create financial challenges. Now, I want you to think with me for a minute. Can you think of another industry in our nation which governments directed to give away goods and services at free or sharply discounted rates? For a sense of the amount of charity care provided in Virginia hospitals, consider this. From 2008 to 2014, Virginia hospitals provided charity care of $3.8 billion with a B, dollars. When the public becomes aware of these complicated facts, they're rightly concerned. New polling from Mason-Dixon shows that 76% of Virginians are concerned about the future of Virginia hospitals. The same poll found that 59% of Virginians are concerned that state and federal health care policy change could impact their ability to access health care and what it costs. Despite challenges, Virginia hospitals continue to innovate on treatment, medical research, medical education, and earn recognition for delivering exceptional care. And we also welcome the opportunity and responsibility of meeting the health care needs of all Virginians, and to actually change that conversation from sickness to wellness. In Virginia, more than 75% of hospitals are nonprofit. My system, Bon Secours Virginia Health System, has hospitals in Richmond, Hampton Roads, and the Middle Peninsula. We have more than 11,500 employees, and we serve countless Virginians. Some of our hospitals are presently on firm financial footing. Others, including Rappahannock, DePaul, Maryview, and Portsmouth, have struggled with negative operating margins in recent years. The financial challenges facing some Virginia hospitals and health systems can be observed both in the rural and the urban regions. These pressures can impact patients' access to care, hospital stability, and our economy. Add to that the uncertainty about how healthcare policy change from Washington could impact our healthcare system. For all of these reasons, you will hear our message over and over again: do no harm to healthcare. We look forward to opportunities to work in bipartisan ways to continue to enhance healthcare quality, safety, and value for all Virginians. Now, I'd like to turn things over to our VHHA Board Chair, Augusta Health President and CEO, Mary Mannix.
Thank you, Tony, and thank you all for being here this morning. Lots of themes you'll hear in my comments that Tony has introduced to all of you. There is a lot of political activity around healthcare at this moment. It's really unprecedented. And we know that the President-elect and the new Congress have vowed major healthcare policy overhauls by repealing and replacing the Affordable Care Act that became law in 2010. Patients and healthcare providers now face the prospect of another significant change to our healthcare inside of a decade, inside of a 7-year period. That's somewhat disruptive. Due to that, there's great uncertainty, potential volatility for all of our healthcare delivery systems. Because so much is really truly unknown, several legislative leaders in the Virginia General Assembly have signaled a desire to wait and see what Washington does before pursuing any major state health care policy changes. And we welcome that approach. We think that makes tremendous sense. It makes sense because these are important decisions that have real impacts on people's lives, people's well-being, and this also has economic ramifications for all of the hospital systems within Virginia. And we also understand that a solid majority of Virginians support that approach. Tony mentioned some poll numbers from Mason-Dixon a few moments ago. Another finding by Mason-Dixon is that 56% of Virginians want the General Assembly to wait on Washington before making any big moves in Richmond on health care. So we are requesting our colleagues, our policymakers, to do no harm to health care. Decisions made by the incoming White House administration and Congress could have a dramatic impact on hospitals, our health care networks here in Virginia, and patients' access to care. By one estimate, Virginia stands to lose $2.6 billion in health care spending associated with people newly insured under the Affordable Care Act if that law is repealed. Of that amount, hospitals alone stand to lose $986 million. Also remember that the Affordable Care Act includes deep cuts to health care funding, and this equates to about $1 billion $1 billion annually to Virginia hospitals with the full implementation of the Affordable Care Act. So our do no harm message also extends to Washington, where we ask leaders contemplating major health care policy to undo deep funding cuts and improve our health care system so providers can continue to do what they do best, and that is serve all patients in need. Our message also applies to Certificate of Public Need. Hospitals are vital to Virginia, and as providers of essential health care services to patients in need, and as major employers, and as key economic contributors that support the economy and many local businesses. As Tony noted, healthcare clearly is not a free market system. Hospitals operate under many care mandates that have real-world costs. We take care of all comers, regardless of their ability to pay. In that system, Virginia's COPN is so important. It's a balancing lever that supports access to quality care, helps control costs by offsetting the impact of charity care inherent in our healthcare system. Full or even partial deregulation of COPN could destabilize Virginia hospitals and put at risk the public's access to healthcare and the economy. As CEO of Augusta Health, I can tell you that our community health system would look very different if COPN were to be partially deregulated or fully deregulated. It would enable new market entrants to cherry pick the profitable services provided while we leave hospitals to absorb all of the charity care. And most Virginians have similar concerns. In fact, 59% of those surveyed told Mason-Dixon pollsters that they prefer our current system over a potentially deregulated environment. Perhaps that's because our system is working. While a majority of states maintain COPN laws, Virginia has the lowest per capita healthcare expenses and per capita expenditures than most states without a certificate of need. Deregulation runs the risk of harming our healthcare system in a moment of too much uncertainty, when hospitals already face financial challenges around the Commonwealth. A good amount of that is attributable to charity care and government mandates. The latest figures show that 27% of Virginia's acute care, critical access, and children's hospitals, and more than 43% of rural hospitals operated in the red in 2015. That is a very significant statistic. Hospitals that are facing financial pressures associated with the ongoing trend of operating in the red this has alarming implications for access to health care, for Virginia's economy, and for these local economies where the healthcare systems are the largest employers in the region. Fortunately, we're lucky in Virginia that we've not experienced a rash of hospital closures in recent years. Even so, the public recognizes the risk to rural health care. 86% of Virginians say that they're concerned about the future of rural health care, in accordance to the Mason-Dixon polling. During last year's session, the 2015 COPN workgroup process, and after, Virginia hospitals proactively worked with our colleague policymakers to identify meaningful ways to modernize and enhance our COPN process. We didn't say we just want things to remain the same and the status quo is what we want to preserve. We acknowledge there is an opportunity for change and improvement and to make the COPN system better, more dynamic, more progressive. While legislation to do that did not favor in 2016, Virginia's hospitals remain ready to work with all parties to find consensus on responsible and comprehensive healthcare policy reform that benefits patients.